Hi, want to show you a little bit here in Athena how to use the chart to do an ingrown toenail. Here's an ingrown toenail left foot. You can see information that my staff previously entered. Review systems. If it's missing, you just add in the brief review systems. Physical exam. You can see here in the picture. So in this patient, you can see that it was on the left lateral border. Okay. For some reason they put right, but I think it's the left. Okay. The left lateral border. So we can switch that. When you switch it, you just hit save. And it says left right here, so it's already there. All this is normal in the vascular exam, young gentleman. There's a little bit of erythema. Edema didn't probe to bone, no granuloma. It was incurvated. There was no purulence. It was the lateral border. So I have that, and it's already, so if you see here, when you make a mistake, it was on the left. So it says right foot. So to clear everything, you do clear, and you go to the left foot. So there's no erythema, a little bit of erythema, no probing, granuloma, no drainage. And it was the lateral hallux. Neurological musculoskeletal was all left, and once again, it was all normal, and then on the left side. Pulls in the procedure, left lateral hallux. Assessment and plan. Right here, it pulls in paronychia, so you have to usually choose. That pulls in automatically. It has some instructions that I already put in here. I have some information on our website. Pulls in this discussion note. These are all done through dot code, so if you hit dot ingrown, it pulls in ingrown toenail follow-up, ingrown follow-up infection, ingrown toenail. This is the one that it pulls in automatically, and I can show you that later. It's done through a different aspect of Athena we can cover later on. Return appointment is in 2 weeks. And the appointment will be on a paronychia follow-up. And I hit next, and then you can do a letter to the doctor that they saw just by doing that. And then the billing tab, I'm not going to show you that because it'll pull up the patient's name, and I don't want to have any HIPAA information, but it's pretty easy to do the billing tab as well. And then you just hit sign and close. If you find this beneficial, just let me know, and I can. There's a little link underneath, you can get to the all these discussion templates and other types of templates for your liking. Hey.